This looks like a very formal start to what we hope will actually be a relatively informal and constructive dialogue.
Built around some presentations, but it's really important that we actually keep it as informal as we can and share information. That's actually what this is about. Firstly, I'd like to welcome you all here. It's in a way a celebration, in a way, of a very successful collaboration in respect of the activity that's been going on the social protection and the social protection floor activities. What we have seen is all of the stakeholders actually working extremely well together, and specifically some quite significant advances in respect of the collaboration that has been achieved between the World Bank, World Food Programme, and the ILO in respect of the use of their own specific modalities. The three organisations concerned have actually worked together for the last 18 months on a sustained basis, in which they have brought together the two modalities of the United Nations Social Protection Assessment-Based National Dialogue Framework, the ABND as it's referred to, and the World Bank Social Protection Assessment Methodology, the SPA. And this was attempted in order to avoid duplication and hopefully to foster what we both were looking for in terms of the access to data and information, and also a collaborative approach of all stakeholders. The process that was developed that we needed was basically a participatory and an inclusive approach over the whole of the life cycle. And that approach was adopted. And from the advice that I received on not a daily basis, but a regular basis, was that actually it worked extremely well. What it did for us was that it allowed, through the combination of the two methodologies and the World Food Programme's provided support on facilitation and in gathering the Myanmar evidence. Basically what it did was it shared the burden of the data collection, and it also avoided fatigue amongst a lot of the key stakeholders. And I think that the result displays that cooperation, which is extremely positive. For the ILO, this work has been embedded in the advocacy for and the support to the implementation of what we call Recommendation 202 on the social protection floor. This is part of our international framework of standards. At the heart of the concept of social protection floor is the coordinated set of social protection benefits and services that ensure clarity and ensure income security at a household level. So this coordination element, we believe, was absolutely essential in order to achieve the end objectives. And it is useful that it has taken place because we believe it then can be mirrored in respect of the ongoing government endeavours in terms of policy, and also the ability of development partners in the implementation of follow-up decisions that are taken in the policy environment. So in a country like Myanmar, where we're going through a transition towards democracy, where we've got the peace-building activities that we're facing, this sort of cooperation between development partners in recognizing existing modalities and being able to bring them together to work for the good of all, we believe is actually an extremely useful example. And we feel that actually having a small event like today to cement that into place and to try and give it as a shining light for other development partners potentially, we're looking at similar approaches, in itself is actually quite important in our belief. we see that hopefully if that sort of approach is adopted, that it's an opportunity to expose a much wider group of actors to international experiences through that sharing of modalities, and allows them also to take part in multi-stakeholder discussions on a much more informed base. Secondly, we see it as a way of actually bridging policy-level dialogue, which remains at the moment, and also with the social protection implementation activities, which at the moment is pretty much in the hands of the development partners and community organisations. But indeed, in order to progress, we need to be moving away, if you like, from the development partners' emergency response environment to one of a more structured, policy-planned approach. And we believe that this exercise lays the foundations for assisting in that change. So we hope that the discussions today will help explore how tools and evidence generated by the ABND and the SPA can be helpful in expanding the policy options and in supporting the programming of development partners' future activities. It would be good if we could discuss how these tools could be mainstreamed and to promote possible other synergies out of those discussions. Or whether, in fact, other platforms or areas within the broader development policy agenda could benefit from the experience that is gained from the combination of these various modalities and the cooperation that exists. We would very much like to, from the ILO's perspective, to thank the World Bank and the the WFP. Who? For the collaboration. And I have to say that from an organizational point of view, this is extremely positive. Most of you have probably at some stage or other either worked in or with the UN type structures, and sometimes relationships are not easy. Everybody has their own mandates and their own objectives, and although we all talk about being one, the reality is that we are many. And to have the situation where, in fact, we have been able to work as organizations loosely within the same system, but actually using our methodologies together, actually is not just useful for Myanmar, it's also an example globally. And in fact, what we have seen recently, and the timing is almost perfect, where the World Bank at top level and the ILO at top level recently announced the joint mission in terms of their ongoing collaboration. And I think that probably the Myanmar experience will actually be the first to inform that global initiative, with the prime objective, of course, being that we don't leave people behind in the countries that we're working in, that social protection is there for all. So thank you very much indeed for joining us. And please, the issue as I see it is the continuation of debate. Out of the process we've been through, we now should continue to talk to each other. We should not stop that ongoing debate. So thank you very much indeed.
Unfortunately, Thorsten from the WFP he's sick today and he couldn't make it. So I think Mariana will cover for him.
I'll try. My best.
All right, so this is just a short presentation that to just make sure that everyone is on the same page before we can go ahead with the roundtable. Okay, so this is the joint process that, we said 2014, but actually that started in 2013, whereby the ABND and SPA methodologies were combined. So what we try to do is to keep the objectives of both methodology achieved, but in a combined way. So the assessment-based national dialogue is a methodology to assess the social protection situation in a country and to propose priority recommendation to build social protection floors. It was completed or is being completed in a number of ASEAN countries such as Thailand, Vietnam, Indonesia, Laos, or the Philippines. And it's a national dialogue basis. So it's mainly the interaction among stakeholders and what people bring into the table that makes the exercise valuable. And in that respect, it was really interesting to have the World Bank and the WFP putting in place the social protection assessment, because it brought into the table a large number of evidence that were most needed in formulating, a clear assessment of the social protection situation in the country and be able to propose tangible options for the extension of social protection. In this respect, the World Bank had started before the ABND methodology took off. So an inventory of social protection programs was already available at the beginning of 2014 and fed directly a social protection assessment matrix in which were mapped all the social protection programs that exist in the country, what were the gaps, and then what the stakeholders could recommend as priority policy options to close the coverage gaps. I think we will go more in depth into how each product of the SPA fed into the ABND process. So maybe quickly, the assessment-based national dialogue is a methodology that puts a large number of stakeholders together. Employers and workers organizations, research institutions, agencies of the UN country team, other development partners, civil society organization, and of course, all the line ministries that are concerned by social protection. The reason for this is that the emergence at global level of a consensus on the social protection floor was related to the fact that for a large number of years, the UN and the governments have been working in quite a scattered manner, and in the vision of extending social protection to all, it was underlined that one very big bottleneck was the absence of coordination and the dispersion of resources. Human resources, but also financial resources, etc. So in this endeavor, that methodology appeared, and at its heart, you have having a strong multi-stakeholder consultation process. And so people are consulted at every step of the methodology. Then we'll go quickly through the steps. So normally you have a first inventory of scheme. In the case of Myanmar, that was done already by the social protection assessment. And then you have a first dialogue on trying to look at what exists and what are the gaps along the life cycle. So we look, we look for health, then we look for children and active age and old age. So the first dialogue on this, draft matrix was held in March 2014. Then those first recommendations that we could see to fill in the coverage gaps are translated into policy recommendations and practical scenarios. So for this, the SPA was a source of evidence on what works in terms of design features of programs in Myanmar. So Myanmar is a special case, right? Because you have only a limited number of government-led social protection programs from which you can take evidence and look at design features of a social assistance program. You have very scattered and small assistance program at the government level. So having, evidence that came from also the development partners-led programs to look at whether cash or food transfers were more appropriate, what kind of vulnerabilities were people facing on the ground, and what was the empirical experience that NGOs and also development partners could have already gathered that could inform the dialogue. So that happened in May, June 2014. And then we started collecting data to cost the different policy options. So in terms of practical scenarios, it's a national dialogue, so you have all the stakeholders, everyone wants one program, so we had about 70 scenarios to cost. So that took us until September. And then by then, we gathered all of those data, even though there was no dialogue during that time. A lot of your respective organizations helped us collect data and try to have a model that's as accurate as possible. And then that was in September. Then we finalized the costing and did a fiscal space analysis and wrote the draft final report, which was shared with the National Social Protection Technical Support Group at the end of September. Then, a lot of you guys sent us comments on the final draft. And then some of the recommendations were included in national policy. So I think that's the overview.
For those of you that don't know me, I am Mariana Infante. I am the social protection focal point for the SP assessment in Myanmar. And we have a broader team in the World Bank working on the social protection assessment. So here is Pooja, the team leader, and Kay back there. But we had also, I want to think about it as an extended team of partners that really supported and made things happen at the local level. So as Lou was saying, we had a lot of very close collaboration with the WFP in trying to gather the technical expertise and practical expertise of delivering social protection in Myanmar. But we also had a lot of interaction and partnership with LIFT and its partners, with Dr. Mike exchanging ideas, with other partners, with UNICEF, with the inventory. We had lots of collaboration with different organizations, and I think that is one of the most rewarding experiences in terms of building partnerships and starting at a point where we all brought our initial endowments in terms of technical support. But I think we have grown a lot throughout these 18 months as institutions, and the panel will discuss a bit more about those changes that happen as part of this process. In terms of concrete outputs, I'm going to talk about two outputs here, the inventory and the institutions note, and then I'll go to a different slide where there are more photographs and they will give a sense of reality on how we actually did things. So as Lou was saying, the inventory was our first product, and we based the social protection assessment on the objective of trying to identify evidence of what is a social protection system looking like in a particular context. So our key questions are, what are the policies that a particular country is implementing in terms of social protection? What are the programs that a country has in place to deliver social protection? And what are the delivery systems? So there are 3 levels of engagement: policy, program, and delivery systems. That's kind of the bigger framework of the social protection assessment. It can get as complicated as you want. You can have lots of different questions at these 3 levels. But I think the beauty of the SP assessment is that it can really adapt to a particular context, and you can emphasize different questions, and you can go deeper into particular topics on these 3 levels. So what we found was very important for Myanmar was not to just limit the assessment to government programs or government policies, because most of them were still nascent and still trying to be developed, but it was very important to dig deeper into development partner programs. So that was something that I think complemented very well with the methodology and the discussions and platforms of the ABND in terms of policy dialogue, because I think it brought a very strong perspective from the field in terms particularly of programs and delivery systems existing in Myanmar that didn't necessarily belong to government systems. So the inventory tried to map those initiatives from government, but particularly from development partners. There, it was a good opportunity also to identify who the players are, who should we be talking to in terms of who's doing what and where. So we designed like a very simple Excel table where we try to identify who was doing what where, what type of programs they were using, what sort of instruments they were using, what was the coverage. That was difficult to find, what was the coverage and where exactly they were. But we tried to map this as an initial snapshot of what was going on in Myanmar. And we found that it was very important to dig deeper into three types of instruments. So one was cash transfers, another one was public works programs, and also community interventions, but that came a bit later in the discussion. So that's why our next step was to focus on cash transfers and public works programs. Another note I want to talk about here, which is not very visual, it's the institutions note, because we also thought it was important to have a closer look at the institutions in terms of not only what's going on in Myanmar, but what could be relevant examples from elsewhere. So we drafted two notes with international examples. So one was about Indonesia, and the other one was about Cambodia, and tried to feed this into the discussions on the National Social Protection Strategy in terms of what could be examples that are important and relevant for Myanmar. And I think in terms of Indonesia, it was very important to see how linking some of the policy objectives of social protection with higher level objectives of poverty reduction and have an institution that can bring these together was I think, a very useful message. And that also helped us find a framework to draft an institutions note for Myanmar as well, and dig deeper into the three levels I mentioned before: policy, programs, and delivery systems. But the really fun part of it all was this. So when we went to the field with WFP, with LIFT partners, Save the Children also facilitated some of the field trips, we went deeper into particular instruments. So we went deeper into cash transfers, taking example, for example, of the cash transfer, maternal and child health transfer that Save the Children and LIFT are implementing. Also looking at cash and food for assets in the dry zone, looking at unconditional cash transfers in Kachin, in internally displaced people camps. And we also try to, we were not necessarily very structured at the final products, but we try to include the aspect of migration and vulnerabilities in peri-urban areas. So we also went around Yangon to certain peri-urban areas to try and get a sense not only of the rural perspective, but also the interface between rural and urban settings. So that helped us draft two notes, the cash transfers and the public works. So in terms of the cash transfers note, I think our approach was more to try to identify the appropriateness of cash and try to get some operational lessons that could inform the policy dialogue. So we found, for example, that cash is used everywhere in different contexts, but also that perhaps very simple designs fit better the institutional landscape of Myanmar. We also drafted the cash for work note, the public works note, and some of the lessons in terms of the use of cash are also relevant here, but we also try to identify the question of how do we translate some of the existing experience of WFP, of the Tatlan group, into feasible government programs, and how can that transition be? And I think here, well, it's Torsten should be discussing more these, but it is very important to bring the experience of WFP because they have helped us a lot in trying to think about how some of these structures can be mainstream into government structures, and also how can we think about not so much reactive programs, which have been the basis of current service delivery, trying to respond to emergencies, trying to bring some emergency relief. How can this be translated into more sustainable programs that are less reactive and more proactive and have more long-term objectives? And we thought that focusing more on the objectives of food security, of building community resilience, and of trying to bring social cohesion, particularly in areas where there has been a bit of fragmentation and conflict. How can this be structured into government programs? And I think the role of WFP here was crucial. I think that's it.
I think there is something missing on that slide. So I think for the combination of methodology, it's a replicable experience in the sense that practically we just define steps jointly, planned over a precise timeline what was going to happen and when, and how we could also somehow make this sequencing fit with the work plan of the sector working group on social protection, which is co-led by the Ministry of Social Welfare, Relief and Resettlement and UNICEF, so that those could actually be useful inputs for reaching some policy outcomes. Also, I think that we've established somehow a platform for knowledge sharing and physical web platforms, but also various events. I think one lesson learned that can also be maybe reused in a context such as Myanmar. One challenge of implementing the assessment-based national dialogue in this country is how to mobilize stakeholders that are not used to sit down together at the same table, and how to engage with a number of organizations that don't necessarily have a shared understanding of what social protection is, and won't spontaneously identify themselves as the relevant participants for this platform. And I think we initially benefited from the working group structure and mailing list that was prepared by UNICEF. And from there, we had to also build on the different actors that were identified in the social protection inventory initially to gather more people around. We had, as the ILO, to make some advocacy towards our own constituents, the workers and employers, who, also needed to feel more empowered as regards this topic. And so, remained one issue that, it got better along the process, but it's been very difficult mobilizing CSOs. I think it's also because there is no necessary shared understanding of, what's social protection and how, and how organizations at the community level could A, are practicing it, and B, could share their experience, and C, could demand more. So I think this, combining, some field work on this topic has helped to also identify those people and try to engage them in a broader, maybe higher level discussion. And then this has nurtured a number of policy outcomes. So, of course, you know, the social protection national strategic plan, which formulation was supported by UNICEF, and then the rural development framework, as well as, you know, the current discussions that are happening on universal health coverage are also benefiting from both the field work on the cash note that was done through the SPA and the options that were laid out during the assessment-based national dialogue by the group that was working on health. And in that regard, I think, you know, we're here to explain how we combine methodologies, but, you know, a big chunk of the work was also done by people showing up at the workshops with something in hand, taking the time with a lot of organizations of the UN country team and of some NGOs to facilitate the group work. And I see that there are several of you actually here today who have, you know, taken the time in each group to facilitate the discussions, to put things together, to try and have concrete proposals to put out there and to make them as realistic as possible. And we're talking about organizations that have often very different positioning on those issues. Yeah. I don't know. So, okay, so if you want to learn more, you've seen that we've made a small fact sheet to try and lay out the lessons learned from the process. And then you also have some of the social protection assessment technical notes that are available outside. And the social protection assessment-based national dialogue report. You have a small flyer that summarizes the results, and the report is accessible online. You have the web platforms right here. I think the on the last one, the WFP also put at the disposal of the platform the results of the food security assessments that they've been doing in the country. And this also nurtured a lot the discussions on what should be the priority policy options that we should be looking at and costing. Yeah, so, you know.
That's it.
Maybe we're gonna call upon our panelists, the two that are not sick today and could make it.
But if there are any questions, maybe we can take questions now. Yeah.
I'd better talk to the elephant that's in the room about the ABND document. Some of you will be aware that the document has been finalized, printed, officially launched but not distributed. That is because of a political issue. It is nothing about the substance of the report. And we are very hopeful that that will be cleared shortly and the report will be with everybody in hard copy. It is, however, on the ILO website if people want to access it in PDF form. Okay? Just to let you know that it will come through the process.
Okay. Okay. All right. So I have a few questions for the panel, but you know, by all means, if you feel like you also want to respond and you have additional things to add, feel free to also jump in. So I think, you know, the two first questions that we wanted to look at and that are actually closely related is that, okay, as a result of the combination of those methodologies in Myanmar, a number of policy options were formulated for the expansion of social protection. Now, there are a number of next steps that may involve the development of detailed program design, financing option, implementation arrangement. And so in those steps, that also somehow involve the programming of the development partner activities. How do we think that maybe the tools that were generated could be useful, and have they already been useful in the programming of the organizations that have participated? Miwin, you wanna go?
First question: how the tool has been useful to the policymaker. As you already presented for ABND and the SPA, so you have already showed many detailed information collected from the grounds and from the stakeholder. That's really give very useful information for the policymaker. As you already mentioned, they already used to the social protection strategy and also the development and also for the UXC. Because some of the, as we already can see, many of our programs are very emergency-based and also donor-implemented programs. So we will see very fragmented, that is government-led program. You already, from the tools, your assessment, you already show the policy gap and also the next step that could be done with the coordinations and how can the government can take up the leading role to have to build the building block to go forward for the comprehensive social protections floor. And also you show the policy makers, you have the different options that by costing, and you have the fiscal analysis in that. You show with the low package, medium package, and high package with the different fiscal, based on the fiscal space. So what way the government can start up. That already very useful for the policymakers to me. And also you give I think from that very fragmented programs and very emergency based, you already showed the government that we need time to build the national-wide program and also the sustainable system that give the policymaker where to start. I want to show something. I think, to me, most of the programs, geographically, we are based in the hard-to-reach area and the most vulnerable, as we are based from the charity-based, emergency-based, and also we focus to the most vulnerable. But it also shows the one thing that we also have to focus, one thing that looking at the government Myanmar current situation, how about the urban poor? That also show that our programs are very focused in the rural, and also government should look at from the formal sector. This also show that we have a quite strong formal program that we also need to expand based on the existing program. I think that is the very useful of these two, that for the policymaker to based on that.
I think that was a very good kind of overview of the whole process in terms of the way certain development partners and government may be using the tools. I thought I might just bring it back to maybe how Save the Children has kind of been involved in this process and the way we've tried to use this process. So Save the Children has been working for a period of time with maternity-based cash transfers in the Delta, the dry zone, and now through Tatlan in Rakhine State. And a lot of that evidence and information we have from these programs was generated through qualitative instruments that we have internally, such as the cost of the diet, qualitative assessments we use to work out the gap between what people have in terms of income, expenditure, and what they need to afford a nutritious diet, and also based on the food habits of the households. But this is quite small scale. This is done at the village level, it's done through our staff, and it's something that's hard to talk about on a macro platform. And so through the ABND process, it was an opportunity to start looking at ways that we could look at this on a much larger scale in terms of cost, what it would cost in terms of fiscal space for the government government expenditure, what part of GDP would this be? And I think that was very useful for us to start understanding what the implications of doing something like this at scale would be. And of course, there needs to be the contextual understanding what is happening on the ground. Every state is very different. Every region is very different. But the way Save the Children does this, we can't do this across the country. We can only do this in small spaces. And we've learned some really interesting things in Rakhine over the last almost a year now with this pilot we've been testing. But linking that to a broader discussion at this macro level has been extremely useful to engage DSW, to engage other ministries, to engage development partners at the UN level, to give us space to talk with local partners all the way up to national government entities. And I think that's where the tools have been very useful, because it actually gives us evidence of cost, things that we couldn't show beyond the remits of smaller scale interventions and piloting within 15, 20, maybe 50 villages. And in that way, I think it's extremely useful. And that's how we've taken it forward. We're kind of blending the qualitative information we're getting from the ground, from our local interventions, and looking at ways that we can link this up to a macro discussion on what could be done and how we can move forward, and if this is the appropriate mechanism. And it will adapt and it will differ. What comes out of the ABND is really a tool to be manipulated, adapted based on what we're finding on the ground. And that's how we're using it at the moment. And I presume that's how other development partners would be able to kind of engage with this costing and engage with the information that was brought together in a coordinated sense.
And in terms of partnerships, I don't know if, because I don't know if that helped your organizations, including Pooja, if you want to say something on this. Did you sit with people you were used to sit with? Did this somehow give ideas of possible synergies?
Very much so. Normally, when when the bank starts working in a new country, as part of our own due diligence, we do an assessment of what the landscape looks like. How we would normally do it is somewhat, in fact, very different from how we did it here, because from the beginning it was a planned process, and there was this understanding that the evidence generated needs to be very focused on what's needed at different stages of the policy dialogue. So it was very clear what we had to do when and how broad the scope needed to be. And then in terms of partnerships, it just made it that much easier to think about who we needed to bring to the table, who did we need to reach out to and get information from. This wasn't just about understanding government programs, which is normally the case in many other countries when we do assessments. It's quite unusual to reach out outside of government systems, but in Myanmar it was so obviously the need. And because the ABND, then the dialogue, provided a platform for everyone to come together at this stage and really have these conversations. So for us, both externally in terms of how we collected the evidence, these partnerships were hugely important, and also how we then discussed the outcomes of the evidence and in terms of what policy options could be feasible. Internally within the bank as well, we discovered new areas where we would normally not have spent so much time. For example, the public works note made us, and the cash transfers note actually made us understand how important it was for social protection and disaster risk management to come together. And we started, on the basis of that, we did some more analysis on DRM, and we started talking to our teams that work on DRM, and now we're trying to bring that together. The cash transfer note informed some of the work that our finance sector teams are doing on financial inclusion in Myanmar. So I think internally there were a lot of partnerships that emerged. We started to look a lot more at community structures as a result of these, the field work and the institutions note, for example, and we realized, looking at community-based structures for implementing some of these programs, at least initially, made a lot of sense, and we needed to drill deeper on that. So we forged a partnership internally with our colleagues that work on the Community-Driven Development Project, and then externally with the Department of Rural Development. So I think in some ways the work that they started and the combination of the field work, the evidence gathering, the partnership in doing that, and the dialogue where a lot of different people from very different mandates and backgrounds were sitting together and discussing issues, forced us at least to take a much broader view of social protection and look at issues that we wouldn't normally look at in so much detail. And I think it's been a lot richer for that reason. And we were in APIDO last week where we launched these technical notes. They will be available online very soon, next week. And we could see already some of the impacts from these linkages that have emerged from this process, from the government side.
Yeah, for our partnerships, so as we are based on these two and this assessment, I think it's so many things, coordinations and the partnership among the government department, the ministry already happens. As you already brings the people from different departments, as you mentioned, they never talked before, and they possibly, yeah, sorry. So they work separately and with coordination, but when we have discussions and we bring different people into the table, and also there is some issue about for example, like social security. We bring the people from social security into the social protections conversations and into the discussions, and also the health. And based on this conversation, I think from our research, our institute, so we are facilitating the coordination among these ministries, like Ministry of Finance, Ministry of Labor, and Ministry of Health, and also from the Ministry of the Social Welfare to work together and to have more, alliance to each other, to have more alliance policy from each other. I think from this tool and this assessment is already happens, and it is very useful to us use this information and to facilitate amongst the coordination among the ministries.
I think it's very along the same lines of what's just been discussed. I mean, for us, as part of the child group and facilitating some of the discussion with UNICEF around issues affecting early childhood and children at school, I think it was a very interesting experience to be in a room, which is very rare for, especially in INGO and for other partners outside, say, the UN or government kind of platforms, to be at the same table. So in that respect, it was something that was quite new for us in terms of that kind of engagement, and I think that was extremely useful. And it was an interesting way to start discussing what is happening at that level, and sitting on the same table with, say, the Ministry of Health, potentially people from DSW, and UN partners, and actually discussing the issues and thinking about ways that some of the stuff we're doing on the ground could work at a national level, how things that are being talked to the macro level could maybe be done on the ground level, and engaging at all levels along our programming. So in that sense, it was for me a very interesting process in that sense. I mean, there was a lot of discussion, a lot of debate. I wouldn't say there was always consensus, but I think that was a good thing in the sense that we were thinking through a lot of concepts and ideas. And so for me, those partnerships are very interesting, and it's rare that you have that kind of forum. You don't see it very often, and in that sense, I think it was very useful.
Can I just add one last thing? The point that Matt's making on coordination. Earlier this week, we had a meeting organized by the President's Office, Minister number 5, and he actually had all the ministries in the room that don't always come together. And 2 years ago, 18 months ago, they would have found it very odd that the Social Security Board is sitting in a conversation with the Department of Rural Development, the Ministry of Health, Education, and Social Welfare. And now it just seems like it's normal because their technical people have been going for all these sessions, and they sort of see the linkages. So it was really amazing to see that. And I think within government, there's still a long way to go, but it's they've come a long way from 18 months ago, I think.
All right. I don't know if anyone wants to add something in the room. Yes.
Microtips from SPDRG. Do you need a mic, or is it okay?
Yeah, Mike Griffiths from SPPRG, and we've been part of some of the dialogues, perhaps in the earlier stages. And a couple of things. First of all, just it's very good to see the concept of evidence-based social protection and trying to build an evidence-based, contextually relevant social protection strategy for Myanmar is very, very important. And also the thoroughness of the information gathered at different levels through the process. Talking about evidence and just some other potentially useful sources and types of evidence as you go forward. I think the first one is evidence from the state and regional social protection planning processes. There have now been state and regional social protection planning workshops done in 6.5 of the states and regions. Chin State, Sagaing region, also in Kachin, Gaya, Mon State, Irrawaddy region, and parts of southern Shan State. And I think Bago region is done or will be done very soon. And these have been done mostly through a partnership with the Department of Social Welfare and HelpAge. What these have done is brought together township-level officials from general administration, planning, health, education, who have a detailed knowledge of their administrative area, and has enabled the mapping, detailed mapping of what's already being done, but also a sense of priority areas in terms of social protection at township level. This has generated, the whole process has covered about 110 townships so far, which is at least a third of the townships in Myanmar, and it's generated around about 700 pages of detailed planning documents. So there's a lot of data available. That's one part. I think the other thing to add to that is that, as I think Matthew made the comment earlier, as soon as we begin to get down below the national level, we see very big differences between the states and regions in terms of social protection needs, priorities, and available resources. And I think sometimes we neglect to think what are the available resources outside of central government funding, which could actually be used to deliver social protection. So that's one, I think, large chunk of information and data which could be very relevant. Another large chunk of information and data that I think will be relevant fairly soon, we are just in the process of completing a poverty and social protection survey together with the Department of Rural Development. This is covering 24,000 households across all of the states and regions in Myanmar, and is detailed household mapping plus an opinion survey on what rural households think the government should be doing to reduce poverty, and also some mapping of help-seeking behavior, so crisis behavior. What do people do when they get in trouble? Where do they go for help, and what kind of help do they get? Just for example, we haven't finished all the analysis yet, but we can tell you, for example, the percentages of people that would get a loan from government in the case of food insecurity or in the case of health emergency or whatever. So we have that level of detail, and it would be available probably in the next month or so. And I think it gives us a good snapshot of what's happening at the grassroots. What are people actually doing at the moment when they are in trouble? And it gives us also an indication of currently the huge role which is played by informal social protection mechanisms. So that's the second one. The third one is just, again, going back to informal social protection mechanisms. We've mentioned this, and I think it continues to be an issue that we need to think through how we mobilize the enormous strength of the informal social protection mechanisms and groups that are already functioning in Myanmar. This is an enormous resource in terms of social cohesion, also in terms of the amount of cash that these groups handle. On average, a village social organization is handling $2,500 of cash per year of money they raise and redistribute. So you spread that across the country, and that's an enormous amount of financial transaction relating to social protection. We'd be stupid to ignore that. One of the big questions is, how do we do that? And again, this is part of a new LIFT-funded pilot in one township in Sagaing region, which is specifically looking at the capacity of these social organizations to deliver more formal cash transfers around the 1,000-day grant. So that's taking place in about 40 villages in Nyang Township in Sagaing region, building on work which has already been done in Sagaing region and Shan State on these traditional social protection mechanisms. So I think a lot of this information may well become useful right now that we have a broader framework. This is more kind of grassroots from the community and then the state and regional level, which I think can inform the kind of shape that some of these things take for the future. So just so you know, there's a lot of data out there. If you want the state and regional stuff, talk to HelpAge. They are the repository of all of that information. If you want the stuff on the household surveys, that's us. We've got that at the moment. And that's just a snapshot of a whole bunch of other stuff which other agencies are doing as well. Thank you.
I don't have additional data to share, but I have one question. In your in your assessment as to the way the process has undertaken, at which stage the involvement of the Ministry of Finance, for example, is most critical, and somehow it's bring impacts into commitments on the fiscal space. And I know that we have involved them all throughout, but in order to mobilize it a little bit higher step, have we thought about as to how we move forward?
Thank you. No, that was something that we actually talked about when we started, and we were planning for this, on how do we make sure finance participates both in the dialogue and how we bring them in when we're doing the assessment. So what we did was we actually set up the Budget Department Finance, Umang Mongwin, as sort of the guide within government. So he was our main counterpart on this within government, because we were working with so many different ministries that it wasn't, we didn't really have social welfare or DRD or health or education as a key partner. We had finance. It really needed to be finance or planning, and finance for fiscal space issues was the most appropriate. We've just had a conversation with them. They were at these meetings during the course of this week, and I think they have internalized a lot the findings that have emerged both from the SPA, but also what was coming out from the dialogue and the ABND report, that more needs to be spent on social assistance. So I think they've really internalized that. I think what we needed to make clear was, you need to spend more, but you also need to spend better. So spending more doesn't necessarily mean introducing 20 different programs that are tiny and don't have any impact, but that you really need to think about what you spend on and increase accordingly. So I think from their side, there's a lot of buy-in. And the President's Office's senior minister actually asked the different line ministries to review their budget plans for this budget cycle as part of the medium-term expenditure framework, which is sort of a little bit more long-term planning, to review what they wanted to spend on and to see where it made sense to incorporate social protection elements in it and make concrete proposals for increased spending on SP. So yeah, I think it should hopefully come through.
Maybe one thing we should say is that the involvement of the Ministry of Finance in this country is twofold, right? Because they also themselves are a provider of old age pensions. So somehow they were quite well represented in this exercise, in the sense that the pension department was very active. They came to the platform, and this is something that we usually don't need to do in other countries, but that we have taken the time to do this time, is to actually during the dialogues give some space to the different departments that have some social protection activities to present what they're doing, because we realized that the first session of the dialogue that people actually didn't know. And, you know, the information is not exactly open source yet on those activities. They're not easily accessible. So I think in that sense, the Ministry of Finance was strongly involved. I also think that they had done some previous work because in 2013 UNICEF had prepared 2 notes that were including budget analysis and proposals for mobilizing fiscal space on the basis of taxation of extractive industries, which we know are still a big chunk is in the public company domain. So I think this is also the results of that paper was presented in September by the Chief of Social Policy of UNICEF. And I think the budget department also sent a number of comments to the final report. So hopefully the message has come through. I think as regards planning, they could have been more involved, the Ministry of Planning. I think we had difficulties initially to find the right focal person, and then when it's not the same people coming to the different forums, then that's not easy. So I think that's definitely an area for improvement.
Just a quick technical comment on the Ministry of Finance. I think also as part of this process of the SP assessment and the discussions on the ABND platform, I think there is a more interest on trying to understand better how social protection is accounted for. I think that we have been discussing a lot about the social budget and the big budget lines, etc. But as part of this exercise, we have really tried to dig deeper into what social protection spending is, and not so much about supply side spending, which is what they are more used to acknowledging. And when we presented the 0.02% of GDP spent on by government on social protection, they were quite shocked and realized that, you know, there is something that they are missing in terms of how they account for social protection, and they are actually genuinely very interested in understanding better how to account for that. And we are discussing on how breaking down better some of the budget lines within their current activities can help get a better understanding on how social protection is accounted for. So that, I think, it's really an accomplishment of this dialogue. On Ministry of Planning, yeah, it's true we could do better in identifying some focal points, but I think it's also important to mention that the inventory was discussed by the Ministry of Social Welfare with the Foreign Economic Relations Department with FERD, and it's now part of the aid management system. So I think there was a bit of that dialogue between institutions around information sharing, around government support and DP support to social protection. So that was one of the linkages established.
Good morning, everyone. I'm Lena from UNICEF. And I have a question, perhaps, to the entire panel. How do you think these tools can... So how do you think this combined methodology can be used to prioritize interventions now? Because, as you said, we have these policy frameworks developed. So the rural development strategic framework and the social protection national strategy, both developed last year, so relatively new, and now they're both very comprehensive, and now it would be good to prioritize. So, for example, I was thinking, sitting in Naypyidaw on Monday, everyone was from the minister through the World Bank director down to all development partners, we're talking very much about the importance of investing in children, which as UNICEF we're very happy to hear. And a lot of people also just now are talking about the importance especially of investing in the first 1,000 days. So I was wondering how you think, with respect of different priorities, different mandates of different ministries involved, rural development, livestock fisheries, social welfare, labor, etc., etc. How do we use this to prioritize, reflecting kind of everyone's sense of kind of national priorities versus what you find in the assessment? Thank you.
You can complete the answer. I don't know. I think, well, the first thing is, as much as we've made efforts to collaborate, the prioritization of the policy options is not our mandate. So I think, yes, the tools can be useful in the sense that the costing tool obviously offered, a picture of what does it mean in terms of fiscal space. I think one of the big, win of that model is that it includes health, which I think in the context of Myanmar, where the government has engaged to reach UHC by 2030, it's really important in the sense that, in last year's in this fiscal year's budget, what we can clearly see is that they are upholding this engagement and they are actually consistently increasing the budgetary allocation for health. So now there is an issue of how do we capture this allocation so that it's actually going to the financial protection of people and improving their effective access geographically and financially to health. But I think this is one of the goal of the exercise is that you don't work in silos and you make people conscious that there is only one government budget, not several government budgets. And so I think probably there is a need to mobilize further this tool so that at a higher level, it's also, the evidence is also used. This is something that's, I think, common to a lot of countries, that when it, everyone agrees on a number of things, but then when it comes to budget, it's still a fight. In a number of countries, the establishment of autonomous social protection institutions that only have an oversight of a ministry, but that are not necessarily directly included in a ministry's budget, somehow improves both the traceability of where the money goes in terms of social protection and somehow less, strong, I would say, interministerial fights. So I think in the next steps of thinking what could be institutional arrangements, that could also play a role in terms of trying to see how we can help think about solutions that do not foment competition further. And then I think, the evidence is there that they cannot do everything at the same time. So now they have to, meet halfway.
Before other panelists hopefully reply, I wanted to also maybe just clarify a little bit. Like, for example, in terms of when you were talking about costs, and of course, I fully agree that we have one budget and it's limited, and there are so many priorities other than social protection. But in terms of calculating, the cost effectiveness of this, doing different types of economic evaluations, and what are the returns, even if the investment might seem high, what are the returns for the entire society, for example? And as I mentioned also on Monday in UNICEF, we tried to also do that kind of simulation on poverty reduction and because UNICEF, we're interested in child-focused social protection interventions. So I was wondering whether there is a plan to do a similar exercise.
Well, I mean, I think to a large extent it's been done, because in the final report of the ABND, there are already a poverty impact simulation. Now, you know, as much as we would like policymakers to base their decision on cost effectiveness of interventions, I also think that we need to look at their prior commitments. I'm not also sure that like putting social protection programmatic options into competition in terms of what is only an ex ante poverty impact assessment and is not yet, you know, based on hard evidence, because those programs are not being implemented right now. Up to which points that really going to get us into trouble. So, I mean, I think the evidence is there. I think there is a need to think forward, like how do we mainstream the knowledge on this, and how maybe, you know, the government has already put in place some high-level coordination mechanisms on this topic, and how those mechanisms can also benefit from that evidence, and how the government somehow combines this with prior budget commitment that's been made to some sectors. So how do we tap on money that's already being allocated to maybe do things differently, and in a more social protection sensitive way? So for instance, if you look at all the money that's being spent right now on infrastructure, is there a way of tapping on that money so that it's used in a way that somehow is also employment friendly for, you know, vulnerable people who suffer from seasonal or underemployment? That doesn't mean that it's radically an increase in that budget, but it's also how can we use that money. So now the budget of the Ministry of Health is increasing. How can we see how that money can be mobilized to maybe, you know, nurture some of the programs that are already also in their policy framework. And then, you know, when that exercise is done, how much more can be mobilized. But then for what? You know, I don't know, from an ILO perspective, we can't really ask them to choose between the different categories of vulnerable people. I mean, I think that's a little bit, but I don't know. Pooja, you wanted to say something on this?
Yeah. Very, very briefly, just to say that you can do simulations, but I agree with Lou that the starting point, as we see it also, is what the government is currently spending and what they're currently committed to. This is a very dynamic time for Myanmar, and I would imagine that policy options and priorities is going to take a backseat for a few months until we can come back to look at these. We have the luxury now. In the next few months, there's going to be a lot of data that's going to come available. Hopefully, the census data is going to be made more widely available. There's the household survey that Mike was talking about. The bank has done a living conditions survey. All the simulations that have been done so far have been done on the basis of 2009 data. So, you know, we really do need to be realistic about what we are simulating and what impacts we're talking about, because this is really old data. There's a lot that's happened since. So I think I agree it is important, it is needed, but I think we also need to be realistic about the extent to which policymakers are going to use that to base their decisions, as opposed to moving away from commitments that they've already made, say, to education for all or health, universal health coverage or other issues. And I think it's really, we can present the evidence for them, but I would feel very uncomfortable to say, don't spend on this, but spend on this. But, you know, we can show them what that is, and it's a matter of politics at the end of the day on where they choose to spend their money.
I'm not a panelist, but I'd like to contribute a little bit of the opinion. Sitting in country for 8 years now, I think the questions from UNICEF is very valid, but it is not for us to answer. It is more of the governments to answer. But we have the whole discussions today is the tools that we have provided to the governments. That this is something that is very evidence-based. It is something that brings everybody together as the stakeholders. And on top of everything else, we want it to continue to be a stakeholder engagement all throughout the process, in that people would come in and discuss among the government's stakeholders themselves that, hey, instead of I come to the meeting and I come up with, perhaps we do Mondstadt because it's my hometown. And your kinds of big problems, emergency driven. No, there is something that is evidence-based. And it would be super useful if the stakeholders like us, ourselves, has a buy-in to this package and continue to use it in our advocacy, in our engagement with the governments. Of course, there will be super useful to have new evidence from Dr. Mike, from everybody at all that is together today. And we felt that we have new information that is going to be fed into the tools, that is going to be used and it's going to be replicated again. It's going to be the one that stopped the government, different entities, to compete against each other, to have higher budget in their respective ministry, and see it is more that it is more cost effective to collaborate with each other and look better in the eyes of the people. At the end of the day, it's politicians' decisions, and they want to look good in front of people, and you have to sell it in such a way.
And I'm just going to completely agree with that. This is an election year, and the public opinion counts. A public opinion survey 3 years ago asking the question, what do you think the government should spend money on in the social sector? This has been done. Number 1, child education. Number 2, livelihoods for women. Number 3, livelihoods for persons with disability. Number 4, healthcare for older persons. It's very simple, but the point, it illustrates that it's not difficult to get robust information on public opinion. Public opinion from the survey that we're just doing now. Number 1, what the public wants the government to do for poverty reduction is no interest or low interest credit. Number 2 is livelihoods. And these things I think are very, very helpful because it's a political decision at the end of the day. And we want it to be a political decision because the accountability is to the public. And it's potentially an area where we can also begin to draw in information from public opinion to help those that are making decisions. Okay, this is a reasonable sample of what the public, who are voting for you or not in a few months' time, are actually thinking. I think the other thing, coming back to just evidence, and particularly evidence of impact, all of the state and regional plans that have been done in a way to show potential projected impact. And again, a lot of that is based on assumptions. However, there's certainly one project, and again, if you want to know details, ask Amy Pugh from HelpAge. This is the REVEAL project, which actually measured before and after poverty reduction, a program which was largely social protection oriented, and that showed very substantial reductions in poverty based on some expanded on. But again, a lot of these things, I think, if we're thinking about how to help decision makers make those decisions, it's a political decision. And there are things that we can do to help inform that process, such as public opinion and public opinion surveys done in the right way to help show government what the public feels they should be prioritizing. You've got to be careful with those things. You can skew it any way you like. But I think valid, good, robust public opinion surveys can be very helpful in this and brings that public voice into the room where perhaps up until now it's not been possible to do so.
Just one more thought on that. I think talking about budget and fiscal space and all that, it's quite important, and it has been touched upon several times. But I think one important question that sometimes is not necessarily well understood are the capacity of delivery systems to actually make an impact. And I think that is something that's harder to show because it's harder to just do a nice chart about how important and how developed these systems are. And I think that was one of the emphasis of the social protection assessment as well. And further work from ILO also on the Social Security Board assessment, etc., has tried to also understand to what extent, even if you flood certain institutions with money for certain objectives, how much impact can you really have, and what is the right timing and the right trade-offs between expanding coverage and strengthening delivery systems to make an impact in the longer term. And I think that that is a very important question in the medium term also, and not just focus on great figures and numbers and budget, but also on the capacity of government to deliver in the longer term.
If I may say something that's related to earlier questions, there are lots of questions on government budget, and I know we've been talking a lot about the fact that we need to move from donor-led emergency programs to more sustainable social protection. Now, I think this is clear that in an LDC such as here, actually donor contribution is going to be very important. I think one thing that we can underline is that in this process, and even though in the social protection working group that on the DP side is led by UNICEF's actually collected a lot of donors who said that they wanted to be part of the group, and I think that we can all agree that they never showed up. So at any of the meetings, I mean, we had very good participation, strong participation from JICA and from LIFT who came, but I mean, we don't have a lot of donor engagement right now on this topic, and we understand that there are several reasons for this. Also because it's not an easy topic, and the way of getting out of emergency relief and doing this in a sustainable way, it is not so easy to find out, especially where we're talking about a country where delivery mechanisms, are still to be captured, or models are still to be developed. But I think this is also a very important topic that we should be talking about, because when we look at the other sectors, I mean, we have a lot more donors that are around the table. So this is also a question mark of like, how do we take this further in trying to engage some people that haven't been engaged before. So there is the whole, going to more grassroots level and trying to have some evidence and also participation from that side. And there is the issue of, okay, how do we somehow raise awareness on this also within the donor community?
Thank you very much. I'm Steve Dell from LIF. And I want to try and pull together a few threads of thought here. I mean, this is very interesting, and it's very topical for LIF on a broader level at the moment, because we're really trying to rethink how we engage politically and how we ensure what we do through programmatic activity on the ground in terms of generating good evidence and lessons, how we use that to best effect in terms of influencing policy, because that's where our legacy will be, that's where we achieve scale. And just hearing your comment then, Lou, in terms of the interest or lack of interest amongst donors on this topic, I mean, it's interesting. It's probably just because there's competing interests for their time, but the LIFT donors, of which there's now 13, have a high level of priority on this area of nutrition and social protection. And I think it's just had a shot in the arm with the President's commitment around the whole zero hunger thing, and the donors are certainly seeing the need to engage actively on that. So that's a good opportunity. But the point I wanted to pick up was really the interplay or the nexus between dialogue and influence, and how this has worked out in your ABND process. So maybe just one or two comments before a question. I mean, we can talk about things, as we say in New Zealand, until the cows come home. We can dialogue. But what are we really trying to achieve by the dialogue? And so when we go into dialogue on something, to what extent have we really worked out, or in the initial stages of that dialogue, do we really work out what is the key messaging that we think we need to deliver? What is the key influence that we want this process to have, and how will the evidence and the lessons that we've got inform that process? And to what extent does that take into account a realistic understanding of the competing priorities that government has with its budget and public expenditure? I can recall being at the MCDF earlier in the year and the comment being made in the social protection plenary, I think that's what it was called, that about the key elements of the social protection new social protection strategy, and where the money was likely to go, and of course the wish to get budget for the MCT's component of that, but that it was probably unrealistic to expect that to come in the short term, which of course is what's happened. Wasn't it just last week or the week before or something that decision was taken? So the budget's not there for that, which is disappointing, but it probably was predictable. So to what extent did the ABND process, and any kind of process of that way, factor in the public expenditure realities that the government would need to work with, and then organise the dialogue and the focus of the dialogue in terms of the influence it wanted to have, with that, taking that into account, so that it actually influenced the approach to advocacy that was taken? I guess that's my question. How do we pull together with government through a process like this to maximise benefit for good policy and good budget allocation? This is a fundamental for LIFT going forward. We've got this as one of our 4 key outcomes, and so I'd be keen to hear how the ABND is, what sort of learning you've got from that process.
Well, I mean, I think we can be honest. I think we've learned a lot of things on how pertinent is the ABND and what can be expected in terms of its impact in fragile and conflict-affected states that are going to transition, because this has been applied mainly in countries that are quite stable and that somehow have, I would say, more straightforward, budget processes. And so I think one of the first impact is definitely capacity building, because before you can advocate for people to put in the budget social protection, people kind of need to understand what is it that we're talking about and somehow have a shared understanding of the concept. And so I think, we're talking about 150 people that have, who did partake in this process at one point or another. And I think in there, we somehow have built some shared understanding. So that's I think the capacity building part is the first point of entry. It's technical people. Between assistant director and DG level. Though I think that, somehow the final results have been shared with a number of union ministers and deputy ministers of various ministries. Of course, you don't get the same benefit when you yourself participated to the whole process or when you get the end result. I also think that this process was conducted in parallel to the structuration within government of coordination mechanisms. Because when we started, they still had said that they would create that high-level social protection coordination body, which actually had its first meeting in October. So, I think there is also, that was a parallel process. And in other countries, those high-level institutions are already in place, so you can actually feed them the results of the various assessments along the way, which, wasn't the case. They got the final document, So I think this is also a lesson learned for us. How to influence advocacy. So, of course, it has been more effective with ministries that, in a way, have some experience delivering programs. Because in the discussions that we've had with the Ministry of Finance and the Budget Department, is that my understanding is they don't feel necessarily extremely confident to add into the budget, allocations for things that they have only a remote idea or how they can actually be implemented. So I think that, when we're talking about, social security for the formal sector, pension for civil servants, or delivery of health services, somehow the government feels quite confident that they kind of can picture what we're talking about. And I think the next stage now for this is to be able to also demonstrate what can be the delivery channels, because I think this will be key to also unlock that level of skepticism, on how this can be realistic, not only financially, but like what it could look like. And we should also see how this may underline, help overcome a number of trust issues that are still there when we're talking about government institutions at community level. So I think before they can allocate substantial resources to ministries or programs that would be completely new, there is a need to go deeper in that demonstration effect. And this is also something that we felt very strongly, because in parallel to this, we've been doing training sessions with the parliamentarians, and most of their questions relate to this. What's the traceability of the money that goes to the programs, and what could it look like when we're talking about things that, the government at this moment does not have delivery channels for. And I think in that sense, there is probably more work to do in building on successful examples of practical delivery arrangements. So, I think Matthew was talking about his program before, and I think that somehow gathering more evidence on that side, and at some point being able to envision delivery models is going to be the key to unlock further the budget process. Then there is a need to have a high-level buy-in on things, and so there is also a need to try and repackage a lot of the things rather than trying to push for something that's necessarily called social protection, and wanting to make social protection as such an item of priority. So social protection can be part of the priority on UHC, it can be part on the priority of food security, and I think there is also a need to mainstream whatever knowledge we've acquired up till now, and being able to also package it along those lines.
I might quickly add to that. In terms of just looking at donor interest and looking at the way that we may influence potential policy or budget allocations. Just an example of, we don't sit at that level. We're not talking directly to ministries or line ministries. in terms of the Ministry of Finance and things like this. But I think what we have done using the ABND and using evidence from the ground has been to go and try and get a bit of critical mass around, say, the first 1,000 days, for example, one of the interventions. So what we've been doing is using the calculations from the ABND. We've discussed this with SUN, the Scale Up Nutrition Network. You have the FAO Zero Hunger Challenge that now has it. It's basically taken the first 1,000 days wording from the ABND and from the National Social Protection Strategy and placed it in their new initiative. And they're directly talking with the CSO as part of the SUN network, and they're looking at ways to integrate that. We're also talking with the Ministry of Health, Department of Social Welfare. We're working with UNICEF at a feasibility study on maternity cash transfers, which again is directly using the materials out of the ABND process and other sources that exist in data sets. So that's a more macro level, but it's a way that we're trying to work with lots of partners at that level to try and build some coherence around what is one piece in the whole social protection picture, but it's something that we're trying to build momentum on, because we can't tell the government what they should be spending their money on. It's a political decision. It's a decision of what communities want as well. And I think this will all come out with these data sets that Dr. Mike has been talking about, what the World Bank is doing, what UNICEF is doing. But at the same token, we are trying to build momentum around this topic, and we're using the press. Recently in the Myanmar Times, there was articles on the budget allocations around the first 1,000 days. We're also having a press field visit out to Rakhine to look at the situation on the ground and look at what we've been doing there for the last 10 months. So I think it's trying to pull these pieces together and do what you can to kind of build some voice and momentum around this. And it's up to the government, it's up to communities to decide if this is something that's applicable to them and it's something they want. And especially in nutrition, which is not readily understood by everybody. It's not something that is as obvious as allocations of income or needing for livelihood opportunities. So I think that's one way we're trying to build momentum using these tools in a way that we can as a non-profit organization that doesn't sit necessarily at the higher levels. So that's just a way, contextually, how we're trying to do it.
Hello. Good morning. Good morning, everyone. Hello? Yeah, it's okay? Yeah, thanks. Good morning, everyone. I'm Pupu from Planet Institute. First of all, thank you very much for this kind of roundtable meeting and all the discussion around. As a medical profession and a researcher background, I'm not very specialized in this area of social protection, but I'm personally interested in the health insurance and social insurance policies, and which can be moving forward with this very good long way. That your great job. So, and I would like to share one information that Planet Institute was conducting the national survey on the socio-economic impact of HIV at the household level, which was funded by the UNDP. And we finished the data collection survey in March 2015. And in the next week, 20th, we are planning to sharing the result and the validations of the finding in NIPIDO with the Ministry of Health and other related stakeholders and ministries. And plus on the 21st, next Tuesday, there will be a sharing section with the result and validations of the finding at Planet Institute, Yangon. So I hope some of the partners organizations are already in our email loop, and I'll invite partner organization on the 21st. And if you also have interested for the findings, and we can share after the meetings for the findings. I hope this information can also share to the social protection for the whole, but our study is only focused on the PL-HIV and related things with the sample size of more than 2,500, including comparison with the PL-HIV household and non-PL-HIV household. So we also included the disaggregate of urban and rural findings in our study. So thank you.
Last year, the Human Rights Council of Myanmar commissioned me to pull together all of the research on disability that's been done in Myanmar. And their point was that they just wanted a summary, what's there, what's been done. And it strikes me that we've just got lots and lots and lots of very, very relevant studies, data sets, and a similar exercise could be very helpful for us to actually try and pull together and summarize the key findings of all of these different studies, data sets, and so on, in a way which then it doesn't tell you everything, but it gives you a very clear sense of what is there, what information can we find from this. And usefully as well, it shows what the research gaps are. We were surprised doing disability studies in Myanmar that there had actually been about 30 studies, so way more than you expect. So when you start to look, you can find a lot of information there. And I think something very similar, we could summarize it all on 2 pages. So something very similar may be helpful to us. Who has done what studies? This study on the socioeconomic impact of HIV, very, very helpful. There's probably a dozen studies looking at socioeconomic impact of a number of other social conditions. So that may be something to think about, a kind of somehow compiling not a common data set, but a summary of all the research that's been done in Myanmar. Don't try and do it for everywhere else, because that'll take several decades. But what's been done in Myanmar so far, and what are the information gaps? I think we find there's more data available than we think. And we also need to get a sense of the quality of that data as well, because some of the data is good, robust, some of it is rubbish. And it's been done, but it's been done badly, and we need to redo it. So I think it's just an idea whether that, particularly when we're looking at advocacy, we want government to be making good decisions based on good evidence and a good understanding of good evidence. And I think part of what's happened so far is an appreciation of the need for that. But then what evidence do we have, and is it good? And so that may be something to think about as part of the what next.
Speaking of missing evidence and data gaps, I think we stopped here where we could with the notes because we realized we could do this for years, but we also realized whatever we do gets dated very quickly. So we finalized our notes on one Thursday with everything in there, and on Friday the census data was released. So, things are going to change very, very quickly. But there are some obvious gaps. Disability is certainly one. But also, we haven't really looked at labor market issues. And that's huge for Myanmar. We haven't looked at urban issues. We haven't looked at migration. These are 3 massive topics. And when I think about it, I think, what did we actually look at? We did look at a lot of things, but a lot of it is rural focused. So I think it's really going to be important looking at the rural-urban dimension, the issues of migration, looking at labor markets, informal labor markets, and what research is out there, what evidence is out there, what can we do to apply these same kind of tools, perhaps, to get people around the table to share, to have a platform for sharing what everyone's doing, as you said, which is hugely important. And starting to understand where more work may be needed to advance our understanding of this. I think these are really big issues that still need to be addressed.
On this idea of a summary, I think this is a very good idea. I think the World Bank team who is working on the survey, they've done this, because we've received it because we are doing the labor force survey this year. And so all of those people have come together to list all the surveys that are happening, when, and, it's not a very big file, right? It's a small thing, but it gives you a good overview. So I think this is definitely something that's doable.
Thank you for the presentations and input so far. It's very educational for me. I don't come from social protection background, so this is a great learning opportunities. But because I don't come from this background, maybe I'm asking you a question which is maybe of a beginner. I work for a migration agency, and whenever I listen to discussions surrounding social protection, I'm trying to see how migration fits in this bigger piece of social protection. My question is that when people cannot survive, they make decisions to be able to survive. And migration has always been one of those decisions. And from today's discussion, I understand that social protection is another way to provide assistance for them for survival. There has to be some way out. And migration is often used to find a way out of the difficult situation that chronically face these people. So you are now focusing on assistance programs such as cash transfer or cash for work, all these things. But then you can't do this forever. So how do you actually incorporate sort of longer term strategy into some of those essential assistance you're providing to meet the survival needs of these people in a larger scheme of things when you're selling these ideas?
Sorry, I feel like I'm talking a lot. This is extremely important. I think, Lou, you made the point also in response to Steve's comment that much of what needs to be proposed, much of what will resonate as acceptable social protection here is going to be things that leverage other items. So whether we talk of cash transfers that leverage nutrition outcomes or education outcomes, that has far more acceptability than something that's sort of designed as a cash transfer purely to reduce poverty. I really do feel that. And the same thing applies for cash for work, because it's also leveraging infrastructure at the community level that eventually is also expected to increase productivity. And I think the same thing applies to migration to some extent. I think that is a way out for many people. What you want to do is to make it a positive, a pull factor, right? So it should be economic-driven migration is what you would ideally hope for. I think for Myanmar, what's going to be really important is to focus. Social protection is one part of the story. What's really needed is productivity increases in agriculture. You need more non-farm options. You need far more jobs that are going to be the long-term strategy. Social protection cannot be a substitute for jobs, for livelihoods in the future. So it really has to be, I think that's another area where we really do need to think about how these come together, and that's why it's quite attractive to think about social protection at community settings, is because that's where all of these issues and concerns come together of what can actually be done. I don't think we can think of cash for work as an alternative for a job. It's a temporary safety net for people who are unable to find livelihoods and jobs elsewhere, and who may not have the wherewithal to migrate or may not wish to undertake that displacement.
If I can add to this, yeah, I think there are two things. So one is like, I think social protection, in the first instance, can foster safe migration. We don't believe that migration is necessarily going to end or needs to stop either. Especially with the whole rural-urban shift, we do know that's what's coming around the corner. So somehow, I think that social protection can play a role in making that migration safe, and can play a role in also trying to tackle, or at least to prevent, a number of issues that are also related to unsafe migration. So trafficking, a number of those issues, and then from a programmatic point of view, when we're thinking about social protection, it is very important to take into account migrations, because then that's where we're going to enter into the regional disparities of the country, and very soon the regional disparities among the ASEAN community, and how do we make sure that somehow whatever is going to be a future entitlement for people needs to be portable, and so that somehow we don't foster inequalities further by targeting programs geographically I would say in a long run, but rather make them so that when people migrate, it's a choice, and also they kind of maintain the same level of social protection that they can enjoy if they are affected by a life contingency that makes it necessary for them.
Yeah, comments is not maybe not related with the social protection strategy, but I would like to share what our research institute have been doing related with the rural development. We recently done the survey in Mon State. We are focusing the value chains so mainly like rubbers, and so the livelihood of the rural people of Mon State, so rubber, rice, and the fishery. That we are also looking at so many migrants. In the survey, we are asking about the migrations, and also we also interested on their return when they come back. What kind of opportunity that we can provide them, and what kinds of. So I think it's one of the aspects of the social protection, the promotion part. So we are at the same time when we are focusing, we are talking about the prevention and the protection part, and also from the others, another part of maybe from the rural development, and that part from the economic development, economic point of view, that we are giving more opportunity and trying to help the small scale at the rural people. I think that is one thing that we can do, and that we can hope for the long term. According to our experience talking to people, people are quite hopeful that they come back and they have such kind of opportunity, and then they can improve their business. And then if they have some kind of workable environment, it can be relief from the poverty. I'm not talking about the extremely poor, but the near poor population. That can be, I think, one thing that we are trying to help and trying to, for the long term of the migrations, and also tackle the promotion part of the social protection. Just sharing what we are doing.
Thank you very much. I'm Dr. Aung Joto, Deputy Secretary General of Program Services from Myanmar Red Cross Society. Thank you very much for this is my first time with the changing partners from the MRCS, because all the series of social protection meeting, this is my first experiences. But I scanned through this. We have a lot of things I thought in my mind about. Oncoming, we are planning for cash transfer programming in emergencies. So that's why I would like to ask you about, you have a lot of these planning on the policy making, program design, delivery systems. Do you have any relation with the disasters or emergencies with relevant to social protection, or the preparedness, response, and aftermath of the emergencies? This is very important. We are also aiming for social inclusions, gender diversities, and dealing in crisis, communal violence, and disasters, different kinds of disasters. And also we are aiming for 1 billion coalition for resilience. But that's why I would like to know more about on building resilience, and also your social protection in emergencies. Thank you.
This is in fact a very pertinent question for Myanmar, and it's one that we started to ask ourselves fairly early in the process. Mariana can speak more to the detail, but in the course of the assessment, we actually went back and looked a lot at what are the mechanisms, the institutional mechanisms and programmatic options currently in place in Myanmar for disaster risk management, and how they map or relate in any way with social protection. At the moment, there's two very distinct conversations that are happening, and what we've tried to do is one of the notes that we did was on disaster risk management and SP, and how the two can be related closely, and add a benefit to both sides. At the moment in Myanmar, that's not happening, but in the course of our assessment, we did discover that there are quite a lot of conversations that are going on. So there's conversations internationally among the countries in this region on disaster risk financing, which really does need a larger pool. There's also conversations on community risk resilience framework that is being developed with the ADB, the UN Habitat, and others that are contributing to that conversation. And I think it's really important for those of us in social protection to contribute to that and be part of those conversations as well, because community resilience is also about household and individual resilience, and we need to bring SP elements into that conversation. So I think it's really something for us to also start contributing in those platforms. Our notes would be available online next week, so I'd be happy to get comments on whether you think those are reasonable.
All right. If we don't have any further comments, thank you so much for coming and for all your wonderful inputs, and again for your participation in both processes. And please, let's continue this informally. We have tea and coffee outside waiting for us. Thank you so much.